The news now, because one key part of the government's plan to ease the pressure on our hospitals is to give thousands of older and vulnerable people tailored support in their own homes. It's claimed 1 in 5 of all hospital admissions are avoidable with the right care. And the NHS in Sussex is already expanding its urgent community response teams, which help patients avoid going into hospital. Our health correspondent Mark Norman has the latest in our Breaking the Backlog series.
You know those times when an adult's going through a physical health crisis, and if something doesn't happen fast, they will be taken to hospital and probably admitted? But actually, they could be managed at home, if only there was a different solution instead. Your local urgent community response team can be that if only.
One of the bigger problems facing the NHS is how to help people who might ordinarily need an ambulance or a visit to A&E, but who perhaps could receive more appropriate care quickly in their own home. The Health Service believes the Urgent Community Response Service can do just that.
And tell her we're 24 hours here, so if she's worried she can phone us any time.
Urgent Community Response are made up of nurses, paramedics, therapists and health and therapy assistants who are there to provide that urgent response to patients in their own homes to keep them well and avoid an admission to hospital.
Clips need to be removed Friday the 3rd, so we've had the referral.
Calls can come from the public, patients themselves, health and social care professionals and even the emergency services. One of the more obvious patients they can offer care for is patients who've fallen and who may well face a long wait for an ambulance.
Many patients will fall, they won't often be injured, but they might not be able to get themselves up. The potential is that we're preventing an unnecessary admission to hospital, because obviously if they're on the floor a long time, the likelihood of going to A&E increases significantly, and then they end up probably being admitted to hospital in a bit of a downward spiral.
There's been investment in new kit to get people off the ground, because often it's not the fall that does the damage.
About 1 in 3 patients who have fallen, and they're not admitted into hospital because of actually the fall. It's the long lie, and that's what we're trying to prevent.
In terms of urgent community response, we're probably looking at about 70 calls a day at the moment from health and care professionals to be able to provide that urgent support.
70 calls, that potentially means 70 people not having to get in an ambulance to go to hospital.
Absolutely.
What's exciting the team here is that in urgent cases they can get multiple specialists to help in a coordinated way in just 2 hours and in 2 days for less urgent cases, and they believe the early results are very encouraging.
Well, Mark is with us now, and Mark, it seems to be working really well. It also seems quite simple. Why hasn't it been done before?
Well, it has in a way, but some things have changed. I think top of the list is the fact they've now got, this is a horrible phrase, the Integrated Care Board, but essentially it's every bit of the NHS in Sussex sits around a table and decides what they're going to do. I think COVID galvanised things a little bit. People learned how to make changes and make those changes a bit more quickly. Then we've got this horrible rise in demand, which focuses the mind, and everyone says we've got to do something and we've got to do it quickly. And interestingly, even the strikes, we've been hearing about the strikes earlier with Charlotte and Piers, but NHS strikes in December meant they were speaking to people in the CCAM ambulance service saying, look, we're here, we can do this, and that again galvanised the service. So I think those changes have meant things are happening more quickly.
And how easy has it been to get the staff on the ground to adapt to this new way of working?
Look, I think in the community trust, the people I was talking to there, they are loving it, because actually it's giving them more to do in many regards. Instead of just going along and doing a few exercises with somebody, they're actually going in when people are in trouble, helping them, and I think it will help recruit and retain staff in many regards. It's still relatively small, but I think it's going to grow. I think everyone's going to be doing it, and as I said, the results are pretty positive.
Oh, look at it, don't they? Mark, thank you very much. Now, Steve Backshall